Chickenpox, also known as varicella, is caused by the primary infection with the varicella zoster virus, also known as human herpes virus 3. After the initial infection, the virus remains dormant in the body and can later reactivate, causing herpes zoster, shingles. Mode of transmission. The virus primarily spreads through droplet infection from the upper respiratory tract or contact with the discharge from ruptured skin lesions. The incubation period is approximately 14 to 21 days. The disease remains contagious until the characteristic pustules have disappeared. Clinical features. The distinctive rash typically appears first on the trunk around the second day of illness and then progresses to the face and limbs. The lesions are maximum on the trunk and minimum on the periphery of the limbs. These characteristic lesions begin as macules, flat red spots, and evolve into papules, raised bumps, vesicles, fluid-filled sacs, and pustules, filled with pus. Eventually, the lesions dry up and form scabs. The rash appears in crops, with lesions at various stages of development present in the same area simultaneously. Low-grade fever is common during the illness. In immunocompromised individuals, the lesions may be hemorrhagic and widespread, with a higher risk of spreading to other organs. Complications may include myocarditis, hepatitis, corneal lesions, bleeding tendencies, varicella during pregnancy, cerebellar ataxia, meningitis, acute glomerulonephritis, interstitial pneumonia, arthritis and osteomyelitis, congenital varicella, Reye syndrome associated with aspirin use. Diagnosis. Diagnosis is primarily based on clinical symptoms and presentation. A zinc smear of vesicular fluid can reveal multinucleated giant cells and epithelial cells with eosinophilic intranuclear inclusion bodies. Isolation of the virus can be achieved through culture of vesicular fluid. Direct immunofluorescence tests are easier and faster for virus detection than culture. Polymerase chain reaction, PCR, can identify specific viral genes. Management. In most cases, no specific treatment is required. Symptomatic treatment includes using antihistamines and topical calamine lotion to alleviate itching. Antiviral medications like acyclovir can be used in adults or immunocompromised patients to reduce complications. Other options include valacyclovir and famciclovir. In healthy children, antiviral agents may shorten the duration of illness if given within 24 hours of symptom onset. However, they are usually reserved for immunocompromised individuals or those on long-term salicylate therapy, as chickenpox is generally self-limiting in children. Prophylaxis. A live attenuated vaccine is available to prevent chickenpox in immunocompetent children and adults at high risk of infection. It should not be administered to pregnant individuals or immunocompromised patients. Passive prophylaxis can be provided using zoster immune globulin, ZIG, or varicella zoster immune globulin, VZIG, for immunocompromised patients or pregnant women with significant exposure within the last 96 hours. It should also be given to infants born to mothers who develop chickenpox up to 7 days before or 28 days after delivery. Thank you for watching. Don't forget to like and subscribe to the channel. See you in the next video.